Jamie, it will be painful, okay?
Yeah.
I have to just... So you need to squeeze my hand as much as you can. Don't worry, you won't.
I don't think you ever grow out of wanting your mum or needing your mum. That's always there.
If I was to have a medal, it would be best hand holder. We'll tell you everything that's going to happen, okay? If you want to. If you don't, then just tell us all to be quiet.
Adults can be very vulnerable just as children when they're alone in the hospital. They can be equally scared, they can be equally petrified about what's happening. Right, let's prep.
23-year-old Jamie has fallen from the roof of a 3-storey building.
So we need ventilator, we need drugs, we need propofol infusion. Fell 25 feet from a ladder onto his back onto a wall, complaining of severe back pain on Entonox. I suppose a bad day is when you have to tell a family member that their family has been hurt in a terrible accident, and you have to go and tell them and describe some of the injuries that they've had. And imagine saying that on Mother's Day, phoning up their mum and saying, your son's been in an accident, this is what's happened to them, and that can be incredibly difficult. Here we go.
Yeah, this is Jamie. He was up on the roof doing some roof work. It's a 3-storey building. He slipped off the roof, tried to grab the ladder, but he's landed on there was like a 6-foot wall between the neighbours' gardens, and he's landed sort of right-sided and on his back. Excruciating pain, very pale, very sweaty when we got to him. But he's complaining of a lot of pain from his back. It's from here all the way down the middle, all round his right side, all round his shoulder.
Everything that we do can impact the patient's life dramatically.
Can you feel my touching here? Yeah.
It's a lot of baggage, but that's why I go home and play computer games. People do have to find ways of go home and sometimes just forget about it and relax.
He is reluctant to take a deep breath in because of pain on the right side of his chest. He has tenderness over right anterior and lateral ribs.
Yeah, it is. You can use that like a 3rd floor onto a brick wall. That's impressive. It's a dangerous job. What we need to do is get you off this hardboard, okay? And then we can examine your back, and then what we'll do a CT scan of your back and your chest, okay? Right. I've got 1, 2, 3.
Then we will be off. You have to start unstrapping.
You don't move, we'll do the moving. I suppose when someone comes in and they've been in trauma and they're complaining of severe back pain, you're really worried whether they've done their spine and whether they've got spinal fractures.
Ready, brace, roll.
Take the board off.
Down an inch or so as the board comes out now. You're nice and secure.
You've got to be very careful because you move them the wrong way and that bony fragment could tear into their spine and cause them permanent damage.
Ready, brace, down.
Does anyone know you're here? Yeah. Your family and someone knows? Good. Okay.
Doctors are performing an emergency ultrasound to determine whether Jamie has suffered any internal injuries.
I'm sure he's just going to have a few fractures, isn't he? Either that or something horrendous. The worst-case scenario is they've cut their spinal cord and they can't walk ever again, and that's something we're not going to be able to repair. I have another patient, I'm afraid. We've got a 23-year-old who was on a roof doing some roof work. He fell 3 floors onto a brick wall. So we wanted to get a CT, C-spine, chest, abdo-pelvis. Okay.
Builder Jamie is being sent for an urgent CT scan.
2 of you on this side, please, just for the log roll. Ready, steady, slide.
Doctors are concerned he may have suffered injuries to his internal organs, as well as fractures to his ribs and spine.
to take his head, or
I'll take his head. When people do come in alone, it can be quite difficult. When patients have families around them, they do provide a big family support and emotional support. I'm coming, I'm coming. The way I kind of look at patients is that treat the individual as if they were your family member and how you would want them to be treated. Right, so they had another quick look. We're still waiting for the formal report. Only injury so far is you've punctured your lung on the right-hand side where all the pain is.
Yeah.
And that's probably because you've got a rib fracture there. What we need to do is put a tube in to get the air out.
Okay.
Okay?
Yeah.
Any other good ones?
Yeah, he's got a hemopneumothorax.
From what?
That's the third chest drain we've put in today.
Oh.
Don't worry, Jamie, I'm here to hold your hand. Jamie, it will be painful, okay?
Yeah.
I have to just... So you need to squeeze my hand as much as you can. Don't worry, you won't.
I don't think you ever grow out of wanting your mum or needing your mum. That's always there.
If I was to have a medal, it would be best hand holder. We'll tell you everything that's going to happen, okay? If you want to. If you don't, then just tell us all to be quiet.
Adults can be very vulnerable just as children when they're alone in the hospital. They can be equally scared, they can be equally petrified about what's happening. And you've got to put yourself in that position and appreciate what they're going through at the time.
So have you got any other hobbies?
Fishing.
Squish, squish, fishing?
Yeah.
My partner is a massive fisherman, you know.
Yeah.
I haven't been fishing ever since when I went with him after a night shift. Someone was having a heart attack at the lake. So I feel like I'm a bad omen for the fishing, so now I just don't go. Squeeze, squeeze, squeeze. It's all right, you can squeeze harder than that. I can take it from the north. Squeeze, squeeze, squeeze. You're doing really, really well. Squeeze, 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 squeeze. I must say, I think that was the bravest chest strain I think I've ever actually seen. There you go, perfect. Are you feeling okay?
Yeah, I feel all right, yeah.
So you're looking a little bit peaky, sweetheart. Might treat you with a bit of painkiller now, you know.
Yeah. How's it going, mate? I'll check that ankle. I can't do the other one. I don't do anything.
Jamie's mother and the rest of his family have joined him in resus.
Mum, that place. Fell off a roof.
That's not good, is it?
It's not good.
So hurt talking?
Yeah. It's hard.
Is he still in pain?
Yeah.
It's very difficult for any mum to keep their composure when their child has been hurt in a terrible accident. Even if you're 40 years old, it's still their child.
Be careful. This isn't the present I wanted.
I know, Mum. I'm so sorry.
Don't be daft. God, are you really in pain?
Yeah.
Be
Nothing
strong,
like
be
it.
strong. You're alive.
Yeah.
People should be with their loved ones, even if it is once a year. And yes, you should love your parents every day and tell them you love them every day.
I just crushed all my ribs on the right hand side.
They confirm that they're all broken.
Most of them, yeah.
Yeah.
Just one side?
Yeah, just my right side.
Does it put you off roofing?
Nah.
Nah. Do you want to go up or do you want to stay with baby?
Thanks for all your help.
No, Rosa. Coming up.
Oh, you're coming up, are you? Sorry.
Yeah. Can't get rid of me that easy.
Jamie is being admitted to a ward for further treatment.